In this video, I'm going to discuss LASIK surgery. LASIK is also known as the flap and zap procedure, and is one of the most common elective surgeries performed in the world. Well over 16 million procedures have been performed since 1991, with an extremely high satisfaction rate well over 95%. LASIK involves opening a flap in the cornea, which is the clear window in the front of the eye, and then using an excimer laser, which is a cool ultraviolet light laser, to reshape the eye, much like sculpting a contact onto the eye. LASIK surgery is elective and is performed to decrease or eliminate dependence on glasses and contact lenses. While we won't guarantee you 20/20, I will certainly do my best to get you the best vision your eye is capable of. LASIK works best for patients with low to moderate degrees of nearsightedness, farsightedness, and astigmatism. I typically do surgery on both eyes in the same day. You'll be in the operating room for approximately 10 minutes, and it takes about 3 minutes per eye for LASIK. I do the treatment under eye drop anesthesia, meaning no needles, and we usually give you a relaxing medication by mouth, typically Xanax. During the treatment, you'll experience a mild pressure sensation, but no pain. To create the flap, the newest, most sophisticated laser has replaced the older laser that most surgeons use to create the flap, making it true all-laser LASIK. After we create the flap is then lifted, and then a cool excimer laser, which is an ultraviolet light laser, is used to sculpt tissue from the cornea to correct your vision. We then lay the flap back down. The flap sticks back in place through the natural corneal pump that acts like a vacuum. While you may have somewhat improved distance vision immediately after the surgery, the vision will be blurry, like you're looking through Vaseline or smoked glass. In addition, the eyes tend to burn, sting, and tear for the first 4 to 6 hours. I'll ask you to keep your eyes closed for the first 4 hours after surgery to let the flap settle into place. Follow-up occurs the next day, then usually a week or two later with either us or your optometrist. We use drops for 4 days after the LASIK procedure, including an antibiotic and steroid drop. The risks with LASIK are low and typically very treatable. In fact, LASIK is much safer than contact lenses. You take twice the risk of losing your vision or losing your eye with a contact lens compared to LASIK. I would like to talk to you a little bit about my experience with LASIK surgery. I was one of the first ophthalmologists in the United States to have LASIK on my own eyes back in January of 1997. I was nearsighted my entire life. I wore glasses and contact lenses and essentially couldn't function without them. I was very active outdoors. I played golf and tennis and swam, and glasses and contact lenses really interfered with my ability to do those outdoor activities. When I had my LASIK surgery, it was not yet approved by the FDA, and I actually went outside of the US in order to have my eyes done. My experience was great. It's one of the best things I've ever done for myself. My surgery was quick, it was painless, and 4 hours after the procedure, I was seeing. My LASIK surgery is now 15 years out, and my distance vision is still excellent. LASIK is one of the most common surgeries done in the world and has an extremely high rate of satisfaction, including in my own eyes. While I can't guarantee perfect 20/20 vision, statistics show that the majority of patients get 20/20 vision, and the guarantee I can make you is I'll take the best care of you I know how.